Welcome back inside the Now Morning Show. 20 minutes after 6 o'clock. Hope you're having a great morning so far. I know if you were affected by the flood and the flood waters, you're probably wondering a couple of things, besides how to clean out and start fresh. Some of the effects that you can have long term can involve your health. And this morning, we want to welcome the CEO of the Southwest Regional Health Authority, Dr. Brian Amor, alongside Mr. Ronald Soyafat, who's the CEO of the Eastern Regional Health Authority, and they join us this morning to chat about the health response during flooding, especially. Good morning, gentlemen.
Good morning.
Good morning.
All right, so we know that floods can have medium and long-term health impacts on persons involved in it. So I want to kick off by asking, what are some of the diseases and the vector and waterborne diseases that we can experience due to flooding? Let me start with you, Mr. Soyafat.
Okay. I thought you would start with our doctor.
Well, we can start with the doctor, actually. That makes sense.
No problem. Good morning again. Some of the main diseases, like the public to know, could be both short-term, like within a couple of days, as well as even could go a little more medium-term over a couple of weeks. So in terms of short-term, being exposed to flood water, you could get like gastrointestinal diseases, manifest as vomiting and diarrhea. You could also get skin rashes, being in contact. Also too, because floods would be relate to ponding of water, you could also encourage vectors like mosquitoes, and that puts you at risk of mosquito-borne diseases like dengue. And then one of the ones that persons know that they could also get from floodwaters, particularly floodwaters that are exposure to dead animals or dead rodents. You could get a disease called leptospirosis, which is potentially life-threatening, could manifest with jaundice, yelling of the eyes, kidney and liver failure, and that could make you critically ill. So really, even though the question is asked about diseases, your best bet is prevention. Do not expose yourself to floodwaters.
Okay, so is it that the water transmit these diseases, or is it that the things that happen to come in the water happen to have those diseases?
The water transmits diseases in some instances. So leptospirosis is it moves well in water. So therefore, the actual microorganism itself transmits well in water. And in the other cases, you breed mosquitoes with the waters because they depend on the water for their life cycle. And then mosquitoes in turn can carry diseases. So it's a bit of both.
Yeah. Mr. Soyafat, I'm coming to you because I know that, for example, Dr. Amor is saying to avoid it at all costs. But I mean, we've seen the flooding videos where, unfortunately, the water coming into people's homes and sometimes it's too late. So if you do get in contact with the water, what sort of treatment is available to ensure that you either still prevent yourself from getting these diseases or at least you treat with it so it doesn't become a long-term effect?
Well, I think the important thing is to practice at home. Good hygiene, hand hygiene, washing hygiene, and so on. But apart from that, our health centers are available to everyone. Should they, suspect that they would have come into contact with anything. So our health centers would be the first level of our response. But of course, as I said, at home, one has to be careful in terms of how you treat water, or that type of thing, and your contact with water, flood waters, and so on.
So, Mr. Soyafat, at what time should you present to the health center? Is it that, okay, water came into my house, my feet was in the water, I go to the health center, or is it at the point where I develop a symptom, then I present to the health center for assistance?
Yes, I think that would be the most appropriate time for you to present to the health center.
Right.
I'm curious as to what some of those symptoms may be that we can look for to then present to the health
center. Is it like a rash or?
Yeah. Do we wait for a rash?
Yeah.
Do we wait for a cold? What do we wait for, doctor?
Well, it's a good question. Yes, symptoms, basically once you're not feeling well or you're concerned about your health. So yes, if you find you develop unable to tolerate foods, as I said, vomiting or diarrhea, if you notice any unusual rashes, particularly those that are very itchy or look a bit weepy and wet like they're infected. And then, as I said, like in the case of leptospirosis or in the case of mosquito-borne diseases, they could present or mimic like flu-like symptoms, like you could get body pains, feeling unwell, feeling very tired or lethargic. So anything that concerns your health, like basically from when you were last well and when you start to feel unwell, particularly if you know you have been exposed to flood waters, it is good to go to the health center, Mr. Soifat says, because apart from feeling sick, if you just feel unwell or if you want information, you can also go to the health centers throughout the country.
Yeah.
Like to quickly add, in addition to whom, you have to be very careful at this point in terms of purchasing food, particularly perishable products, because they could be exposed to flood waters. So you have to be consumer smart what you purchase. And as I said, the hygiene and generally clean your surroundings as best as you can.
Yeah. Now, Dr. Amo, as it relates to the Southwest region, have we been seeing people presenting at the health centers with things like leptospirosis? Have we been seeing any sort of incidents like that?
Not at this time, it's very early. And some of these diseases, even though you're exposed, it may take a while for the microorganism in your body to manifest a symptom. We call that the incubation period. So that could take days or even a couple of weeks. So it is too early, at least from what we're seeing, is too early. One of the earliest things people may get is diarrhea because the microorganism works very quickly. But at this point, we have not seen anything in the Southwest Regional Health Authority, but we are very vigilant and we are educating the public. So anybody comes to our health center now, and we are telling them about everything that we are sharing with your general listenership today about how to look out and to prevent. So we are still doing a lot of education in our health facilities at this
Yeah.
time.
Doctor, I like that you mentioned education because I feel like there are some people who are going to self-medicate. So they might present with a symptom and they want to go to the pharmacy to get an over-the-counter drug. Is this recommended? Because I know some people are going to want to just go to the pharmacy and get a quick fix. So how concerning, I would say, is self-medication?
Um, well, self-medication, it depends when you last well. I mean, there are over-the-counter drugs for minor ailments, but I think the best thing is once you know you have been exposed, if you have been exposed to flood water, whether by having waded through it or having involving cleanup operations, and you start to feel unwell, once you have been exposed, it's safer to probably see a health professional and then get yourself assessed. So it's based on exposure. So I wouldn't recommend that one self-medicate. If you start to feel unwell and you have been exposed to flood water, you probably should go and get a health professional check you out.
Yeah. And Mr. Soyafat, I wanted to hear your thoughts on this as well. And can you also share if any of the residents within that region are also presenting to the health centers at this time?
Well, we always have residents presenting to the health center. And as Dr. Amora says, the incubation period is important to look at. You probably would not start getting symptoms from some of these things for 24 to 48 hours, and in some cases, even a longer period. But importantly, what has been happening is that we have been sustaining a response to the flooding area in the eastern region and I'm sure in Southwest to ensure that the facilities are open to our public. If you look at the Eastern RHA, is one that was fairly hard hit by some of the flooding and so on, and landslides and all of those things. And apart from the diseases that you could get, there's the issue of being cut off in your village or cut off from the health services and that type of thing. We go and we cover the entire eastern seaboard in the eastern RHA. So, for example, Matlot and Guire and Grand Riviere, they were cut off by landslides for a while. And we had to ensure. So we have staff resident in the area. So we maintain the health service in their area. We have our radio communication, so we're in touch all the time. And as you come down the North Coast, we had quite a lot of incidents of landslides and flooding and so on, so that we had to maintain services. And to do that, we had to do things such as institute or widen our shuttle service to get staff to work and so on. Thankfully, we have something called a human resource locator database, and we are able to pull staff closer to their facilities to work to ensure continuity of service. When you come down now to the Manzanilla area, all right, where the road was cut off, and we had another serious challenge there in that Plum Mitan was cut off, which is an alternative route from Sangre Grande down to Mayaro, because we transfer patients from our accident and emergency in Mayaro to Sangre Grande usually. But we were cut off by the Plum Mitan, the beach area, all flooded. So Mayaro was cut off from Sangre Grande. So a collaborative arrangement between ourselves and the Southwest RHA saw our patients. We had about 17 of those, 4 from Mayaro and 13 from Rio Claro. Our patients were able to be transferred to San Fernando instead.
Okay.
Then we had to institute a shuttle service, for example, to get doctors from Sangre Grande to Rio Claro because Mayaro was cut off, Beach, and all of those cut off areas. So we had to actually shuttle patients through doctors through Princestown to get them to Rio Claro.
Right.
All right. And then even when you get to Rio Claro, Mafeking was flooded. So we had to have some other collaborative arrangements between ourselves, the Defense Force, private sector companies, and the Ministry of Local Government to assist in traversing some of the flood areas. So it's been, yeah.
Yeah, I imagine it's been a couple of weeks that you guys have been having to have a rough time at it. But tell me, just to be clear on something, you said just now a collaborative effort between you all and the Defense Force. Is that to get patients out of the flooded areas, or is that to send assistance into them?
Well, it's really to get patients. In this case, it's really to help us to get patients. So what we do, we would have an ambulance go to the edge of the flood from their facility. And then an ambulance go to the other end of the flood from the other facility.
Okay.
The high bed trucks could be used, and we could transfer the patients from one end of the flood to the other, and then continuity goes from there.
All right.
So Dr. We've been having that type of thing.
Dr. Amo, I want to just jump in with you here to find out, in terms of the Southwest Regional Authority, have you guys been able to, I know you're doing collaborations with the Eastern Regional Health Authority, but aside from that, what other efforts are there on the way to be able to get to those flood victims or people who might be marooned or trapped in their parts of the country?
Right, it is similar. Well, our landscape is from really like Tabaquite and Flanagan Town up to the northern part of Southwest, and of course, we go all the way down to Carcass. Our hardest areas were those areas. We had landslips between Brasso and Flanagan Town, so that health center was actually cut off. We could not reach the health center. For 2 days, we have been able to open up today, Tabaquite initially on Monday, and then what people traditionally call Deep South Penal Rock Road. That's an area that was flooded, and again, they experienced a lot of their roadways being cut off. On Monday, we found even Erin Health Center that we started to get rising floodwaters cutting off the roadways. And as Mr. Soifat says, we have to consider the welfare of our staff and as well as the general public. And in the case of the staff, they continue to rise to the call to duty. We monitor absenteeism, but everybody did their very best to come out. So they did their own carpooling, as you say in Trinidad, mop a drop to reach to work to serve. So we are very grateful for the dedication of the healthcare workers. So we collaborated well with the local government through their disaster management unit, so they would give us real-time updates. I know they work very hard, particularly in Flanagan Town. They had to clear landslips multiple times. You would appreciate with the waterlogged soil, it'll clear, you have to monitor, but then you'll get a repeat landslip. So apart from those 3 health centers, we monitored all the other health facilities. They were largely operational. So today, as we go back out, we'll certainly be checking Penal Rock Road, the catchment communities. We have a district health visitor program similar to the rest of the country. So we would have an idea of in our community who, even before floods, are what we'll call shut-ins, people who don't normally come to the health centers. Right. So we would check them post-flood, and persons who would have had cancellations of clinic appointments and so forth, we would have internal arrangements for them to come in, because we relate to our community, so they know they can come into us if they need to get a refill of prescription or meds. Any community that's marooned, we do have, in Southwest in particular, we were a bit relatively spared compared to Eastern, but anybody who is marooned, they could certainly call our hotline number as well, 87 SWARA, or they could call the nearest health center. As I said, we too know our community, and we would certainly get to them if they cannot get to us, either directly with a home visit. I don't think there's anyone in Southwest in particular right now that requires that additional support with Defense Force and so forth, which is a different landscape to ERHA, but we do have relations with these agencies if we need be. So we were relatively spared compared to Eastern, but the health sector response is the same, and the key message is that we really don't want to leave anyone behind, and we are ready to serve.
And thank you very much for joining us this morning to explain exactly what's going on in your constituents, well, in your areas. And please keep up the great work. Thank you so much for joining us this morning.
Okay, thank you for having me.
Thank you for having us. And if I could add just quickly, our thanks to our staff for the resilience and really holding the fort, and also thanks to our patients for their patience in accessing services.
Thank you very much, gentlemen. Do enjoy the rest of your day.
Okay, thank you.
That's Dr. Brian Amor, the CEO of Southwest Regional Health Authority, and Ronald Sawyer-Fat, the CEO of the Eastern Regional Health Authority, just joining us to give us an update on the health response during this flooding time that we've been experiencing. We'll take a quick break. We come back with more inside in our morning show. Stay tuned.